My name is Elbert, and this is my lovely wife, Easter.
Hi, I'm Easter, and this is my lovely husband, Elbert. I'm at home, so I run our house. So basically, I just organize our bills and our paperwork. I cook every day, and then I tend to our son, make sure that, he's on top of his schoolwork.
I paint, I do tile work, I go fishing. I like doing a lot of things with my family. When I moved back home to California, and I walked into Dialysis, first time going there, she caught my eye. First, I wrote a note to her. Can you please give me your phone number? I would like to call you and talk to you.
And I didn't really know what to do, so I called a friend of mine. She's the one who married us. And she was like, Easter, you don't know if he's your soulmate. You don't know if he's gonna be your best friend. You don't know. You should take that risk because life is too short. And then every minute that we spend together, it was just magical to me. And the next step was just to move in together. When we got our place, and our son was going into a lot of school activity, and going to the center, it was draining. Like we could barely sit for a whole football game, and because we're so drained. And so I was just like, I think we should do home dialysis. So home dialysis is you have your own machine. Since he's at work, we do our treatment when he gets off. So when I'm at home, I prep both of our machines. After I hook him on, like in a couple minutes, I hook myself back on the machine. And then that's it. And the great thing is, we're both going through this dialysis journey together. I know that as soon as I got on dialysis, I was taking binders, but these binders were different from the binders we're taking now.
Yes, they are.
The first binders we were taking were pill form. It was huge white football pill that you had to swallow, and it was just the swallowing of the pill, the huge pill. That was a lot. I think I had to take 4 at a time. It was a lot for each meal. So my doctor used Velphoro because my original binders wasn't really controlling my phosphorus. It was sneaking up high. Velphoro helps me control my phosphorus and maintain it. So that's why I switched. With him, they switched him because the other binders he couldn't handle. When I told him about my binders, I said, maybe we'll ask him about Velphoro, see if that will help you. So we bring it up to the nurse practitioner. They actually loved it, and it worked great with me because I didn't have to worry about swallowing a big white pill. I just had to break it down and then just chew it. It's easier to break it down and chew it.
Sometimes the challenge is remembering to take it. But now I made it a habit. Once you make it a habit, you ain't gonna never forget.
I think if they would have gave to us first when we first started, it would have made a lot of big difference on our blood work and how we look at things.
We love Velphoro.
Indication: Velphoro sucroferric oxyhydroxide is a phosphate binder indicated for the control of serum phosphorus levels in patients with chronic kidney disease on dialysis. Important safety information: Velphoro chewable tablets must be taken with meals. Velphoro should be chewed or crushed. Do not swallow whole. Tell your healthcare provider about all the medicines you take, including prescription and non-prescription medicines, vitamins, and other supplements. Velphoro can interact with other medicines. Tell your healthcare provider if you have any of the following: peritonitis, an infection during peritoneal dialysis, significant gastric or liver disorder, recent major gastrointestinal GI surgery, a history of hemochromatosis, or other disease that results in iron buildup in the body. People with these conditions were not included in clinical studies with Velphoro, and your healthcare provider will monitor your iron levels while you are taking Velphoro. Velphoro can cause side effects. The most common side effects are discolored feces, diarrhea, and nausea. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. To report negative side effects associated with taking Velphoro, contact Fresenius Medical Care North America at 1-800-323-5188. You are encouraged to report negative side effects of prescription drugs to the FDA at 1-800-FDA-1088 or visit www.fda.gov/medwatch. Before taking Velphoro, tell your doctor if you are pregnant, plan to become pregnant, or breastfeeding. For more information, please see the full prescribing information by visiting www.velphoro.com.